Nusinersen has been, of course, transformative in the treatment and follow-up of patients, but we know that it remains unmet need. And we know that when we follow a patient in the clinic with a type 1, for instance, type 1B patients who start the symptoms at the age of 2 months and we start the treatment at the age of 4 months, these patients very quickly will do better on a motor perspective. And after 4 injections, the parents will come with the smartphone and show you, look what he or she is doing now, and that he or she was not able to do before. And that's on the motor perspective. But there are other aspects of the disease. And one of these aspects is the bulbar function, so the fact to swallow or to speech. And the other one is the respiration, the breathing. And there were two posters, one from our group in France and the other from the group from London. And these two posters were very complementary because they show actually that what we feel as physicians, that these motor perspectives change very quickly in treated patients, but that the bulbar issues and the respiratory issues goes uh, do not go that fast. We could show it in a piece of data and show that indeed we have several patients who are doing much better on a motor perspective, but nevertheless who develop with bulbar issue and with swallowing difficulties and who needs to be on assistance. And the data that came from London uh, go the same direction and show that actually patients with spinal muscular atrophy who are treated with nusinersen are improving on a motor point of view, but at first are declining on a respiratory perspective. And then the stabilization comes only during the second year, which means that this has real implication for our standard of care. These patients are very fragile during the first year. They are still declining and still increasing their need on a respiratory and bulbar perspective, and should thus then be supported very proactively in our standard of care.